Hello, I'm going to show you guys the bones and bony landmarks and muscles that I want you guys to know for the hip unit. First off, we're going to start with the bone I'd like you guys to know, and that's our femur bone. So it goes right here from our hip down to our knee. So this is the longest and strongest bone of the body, and it is called our femur. Some bony landmarks I want you guys to know. First off is the ASIS. So it's right here in the front of our hip. If you find your hip and kind of follow that along to the front, it's typically about an inch or two below like your belly button line. Typically right around where you wear your pants is going to be your ASIS. So these two little bumps right here on either side, one on the right, one on the left, are going to be called your ASIS. And those are bony landmarks off of your ilium bone. The next one I want you guys to know is the Psis. And if you ever see anybody with those little back dimples right here, they're a little bit closer together than the ASIS. The ASIS in the front are kind of wide. They're kind of out towards the outside of your hips. The Psis are a little bit more inside, part of your sacrum and kind of closer to your vertebrae. But it's these two bony bumps right here, or like those dimples you might see on somebody's back, again, right around the pant line. And those are called your Psis. Next one up is going to be called your greater trochanter, and this is actually part of your femur. So if you look, like your femur kind of comes up and then kind of tilts in a little bit like this. It kind of angles at the top. So the greater trochanter is like the part that sticks out the most of your femur. So if you were to like stand still and then kind of like pop your hip out, that part that kind of sticks out the most, it's a little bit lower than like putting your hands on your hips. That would be considered your greater trochanter. It's almost more down by your pocket. So right about here, and if I pop this one out, again, here's my pocket. It's right about pocket height, and that's going to be, it's that big bony part that kind of sticks out on the side of your hip, and that's called your greater trochanter. Three muscles that I want you guys to know that are kind of very commonly injured in the hip. First off is the quadriceps muscle. This is a group of 4 muscles on the front side or anterior side of your thigh, going from your hip down to your knee. So these are my quadriceps. The next one I want you guys to know is the hamstrings. These are the muscles on the back of my thigh, going from my hips down to the back of my knee, hamstrings. And then the last one is called the hip flexor. This is the most commonly injured muscle in the hip, and it's right here. If I was to flex my hip up like this, it's this muscle that brings my leg up, so kind of right in that crease of where my hip kind of meets my torso. So right there in that region, right there is going to be my hip flexion. Obviously, I'm going to have one on each side. So we have our femur, the bone between our hip and our knee. We have our ASIS, which are those bony landmarks on the front, kind of on the outside. Our Psis, which are those bony landmarks kind of closer together on the back side. We have our greater trochanters, those ones that stick out as part of our femur on the lateral side of our hips. We have our quadriceps muscles. We have our hamstring muscles. And we have our hip flexor muscles right where they flex those hips up. All right, bye.